So if we just exercise, devote an hour and a half a week, 90 minutes of exercise, this would be 15 minutes a day, 6 days a week. A study has shown that death from cancer can be reduced by 10%, cardiovascular disease, 25% decrease. Death from all causes, what we refer to as all-cause mortality, is decreased by 14%. And overall, there was a 3-year increase in life expectancy just by exercising 90 minutes a week. If we do the 18-minute workout 5 times a week, that comes out to be 90 minutes. We can get these type of benefits just by exercising 5 times a week. We could do aerobics 3 times a week, strength training twice a week. If we were to double that to 180 minutes a week, we would get a 4% further decrease in all-cause mortality. So death from all causes would go from 14% to 18%, and death from cancer would go down 1 more percent. So we get most of the benefits. Just 5 18-minute sessions a week is enough. So we don't need to spend a tremendous amount of time. One of the other features of our prevention program is the use of nutritional supplementation. And I feel that most adults over the age of 30, because that's the time and the age at which the aging process begins to kick in, are helped by taking at least 3 basic supplements. Vitamin mineral formulation, some fish oil, and some extra vitamin D. And I feel most people, their health will be benefited by taking these 3, if nothing else. Typically, a multiple vitamin will be more than a 1 a day. You'll need to take 2 a day or 4 a day of these. The vitamin D, typically, this is the one supplement that we actually want to measure to see what the level is in your bloodstream. You want to look for getting vitamin D levels in your bloodstream between 50 and 80. And then the fish oil, typically about 1,000 to 2,000 milligrams of fish oil a day is enough for most adults. So taking these 3 supplements provides a measure of protection for us. In addition, there are 2 specific supplements that I think have anti-aging benefits. Both of these mimic caloric restriction. Again, caloric restriction without the restriction. We've mentioned red wine, and within red wine there is this substance called resveratrol. Resveratrol appears to affect our genes in a similar fashion to caloric restriction, and there is also a prescription drug known as metformin. Metformin is used to lower blood sugar in diabetics, and it does so by making the insulin in our body more effective. So many doctors in the anti-aging community are now prescribing metformin for patients without diabetes because we can mimic the effects of caloric restriction. So these are things that the resveratrol you can take on your own, and you can discuss taking metformin with an anti-aging physician as another way of achieving caloric restriction without actually restricting calories. In addition, we can go beyond the general recommendations and get personalized recommendations by going online. My co-author and I, Ray Kurzweil, have created a website. You can go to this website, the personal program at rayandterry.com, and on our website there's a questionnaire. You can fill out the questionnaire. It has questions such as this. Depending on the answers you get from the questionnaire, it'll recommend a specific series of supplements, a package of supplements that you can take that are designed for your personal history. So there are ways that you can personalize your program as well, very simply. The second pillar of anti-aging, in addition to prevention of disease, is early detection of disease. Because no matter how, obviously we would prefer to prevent a disease as much as possible, but if we're going to get a disease, it obviously is better if we can detect it early at a stage that it can be cured and treated rather than after the fact. A standard annual physical isn't enough. We need to do these more extensive executive type physicals in order to accomplish good anti-aging. And what we're going to do with this, we go back to the rule of 80-20. There's this long period of time where damage is occurring where no symptoms occur. Symptoms occur, we go to the doctor, and we receive conventional care. What we want to do is we want to detect disease up here when the heart arteries are 10% blocked, or 30% blocked, or 50% blocked, or we've lost 30% or 50% of the nephrons in our kidneys, or 30% or 40% of our insulin secreting cells have been damaged, there are tests we can do for early detection of disease so that we can turn this around here and not proceed to have the deterioration that occurs. So executive health evaluations can help with early detection of disease. More than half of all deaths are due to heart disease and cancer. The two of them together, slightly more than 50% of all deaths are due to just these two alone. So if we were able to detect heart disease early and cancer early, we could significantly impact our life expectancy. There are two tests, just two simple tests that are inexpensive, non-invasive, that can detect most cases of heart disease early, and heart disease is our leading cause of death. The first one is referred to as a coronary artery calcium test. It's done with a CAT scan, a special type of CAT scan, and the other is a simple blood test called advanced lipid testing. Yet in my experience, most adults, most executives have not experienced this type of testing that they need to have done for early detection of disease. The coronary artery calcium score basically takes a CAT scan picture through the heart, and we get a picture of the arteries. The arteries appear black in the ultra-fast CAT scan, and these arteries are completely open. There's no calcium in those arteries, no calcified plaque, which is the cholesterol deposits. This was an asymptomatic patient where all of the main arteries in the heart are filled with the calcified plaque. This patient had no symptoms, yet they have extensive heart disease. They did this test, which cost less than $200, takes less than 5 minutes. They found out they had severe atherosclerotic heart disease. They were able to get aggressive treatment, and they weren't one of the statistics to go on to have a sudden heart attack or death and permanent damage from this. The other test that we can do is called advanced lipid testing. It isn't good enough just to know your cholesterol and your good cholesterol called HDL and your bad cholesterol called LDL. We need to know what type of HDL do you have. There's types of HDL that's good, and there's type of HDL that doesn't work that good. There's types of LDL that's bad, and there's other type of LDL that's not a problem. So by doing the advanced lipid testing, we're able to stratify our risk and find out if we need to take steps today, because there's simple ways of changing these things around, both with medications, lifestyle, diet, and other things like that, so we don't go on to become a heart attack statistic. In addition, the second leading cause of death is cancer. President Nixon in the United States declared war on cancer over 40 years ago, yet death rates from cancer haven't changed that much over the past 40 years. They're slightly better than they were, but they're not significantly better, certainly not as much as we would hope. It's now possible to use non-invasive, non-radiation containing technologies for the early detection of disease. For instance, we can use ultrasound to look inside the body and find out if there are things that are there that we don't want there. It says, in other words, are there tumors growing within the liver? Are there tumors growing in the brain? Are there tumors in the kidney? Because these type of cancers, tumors in the pancreas, these diseases are often not diagnosed until they spread. And once they spread, they're in many cases incurable. So we would like to use ultrasound, which is relatively inexpensive. It uses sound waves, so it's not harmful to the body, to detect these diseases. So in our anti-aging center, we've begun to do total body ultrasounds to look inside the body for the early detection of cancer. In addition, we now have something called thermograms, thermography, which measures heat. Women have been using thermography for decades now for early detection of breast cancer. We can use that in addition to mammography. We reduce the radiation to the women with the thermography for early detection of breast cancer.